Ventricular fibrillation causes and symptoms. Ventricular fibrillation is a serious cardiac disturbance that causes abnormal heart rhythms. It can be fatal. For many people with this condition, irregular heart rhythms are the first and only sign of coronary artery disease. Ventricular fibrillation, or VFib, may be confused with atrial fibrillation, or AFib. Both involve irregular heart rhythms, but they affect different parts of the heart. AFib can also signal a serious heart condition, but it is typically a symptom of a chronic problem, not a life-threatening feature in itself. Causes. When the human heart beats, electrical impulses that trigger a contraction need to follow a specific route to the heart. If there is something wrong with the path of these impulses, arrhythmia or irregular heartbeat may occur. When the muscles in the four chambers of the heart tighten, a heartbeat occurs. During a heartbeat, a chamber closes and pushes blood out. During a heartbeat, the muscular atria or smaller upper chambers contract and fill the relaxed ventricles with blood. The contraction begins when the sinus node, a small group of cells in the right atrium, emits an electrical impulse which makes the right and left atria contract. The electrical impulse continues to the center of the heart, to the atrioventricular node. This node is located on the pathway between the atria and the ventricles. From the atrioventricular node, the impulse travels through the ventricles, making them contract. As a result, blood is pumped out of the heart and into the body. Symptoms. The most common signs of ventricular fibrillation are sudden collapse or fainting, because the muscles and brain have stopped receiving blood from the heart. About an hour before ventricular fibrillation, some people experience dizziness, nausea, pain in the chest, tachycardia, or accelerated heartbeat and palpitations. Versus atrial fibrillation. The left and right atria form the upper chambers of the heart, and the left and right ventricles form the two lower chambers. Together, all four chambers pump blood to and from the body. When the atria, the two upper chambers, contract at an excessively high rate and in an irregular way, the patient has atrial fibrillation, or AFib. When the two lower chambers beat irregularly and flutter, the patient has ventricular fibrillation, or VFib. Both produce an irregular heart rhythm. Ventricular fibrillation is due to defective electrical impulses. It causes the ventricles to quiver uselessly, pumping virtually no blood into the body. The heart ends up without an effective heartbeat. Blood stops flowing around the body, and vital organs, including the brain, lose their blood supply. A patient with ventricular fibrillation will typically lose consciousness very quickly and will require immediate emergency medical assistance, including cardiopulmonary resuscitation, or CPR. If CPR is delivered until the heart can be shocked back into a normal rhythm with a defibrillator, the patient's chances of survival are better. Ventricular fibrillation, or atrial fibrillation. Which is more serious? Ventricular fibrillation is more serious than atrial fibrillation. Ventricular fibrillation frequently results in loss of consciousness and death, because ventricular arrhythmias are more likely to interrupt the pumping of blood or undermine the heart's ability to supply the body with oxygen-rich blood. Ventricular fibrillation can cause sudden cardiac death or SCD. Sudden cardiac death accounts for about 3 lakh deaths annually in the United States. SCD can kill a victim in minutes, and it can occur even in people who seem healthy. Risk factors. The following risk factors are linked to ventricular fibrillation: previous ventricular fibrillation, a previous heart attack, cardiomyopathy, a disease of the heart muscle or myocardium, cocaine or methamphetamine use, congenital heart disease or being born with a heart defect, electrocution or other injuries that cause heart muscle damage. Heart attack is the most common cause of ventricular fibrillation. Diagnosis. Diagnosis of ventricular fibrillation is usually happens in emergency circumstances because the patient has lost consciousness. The following diagnostic tools can confirm ventricular fibrillation. A heart monitor. This device reads the electrical impulses that cause the heart to beat and will detect either no heartbeat or an erratic one. Checking the pulse. The pulse will be difficult to detect. It may either be very weak or absent. Diagnostic tests can help to find out what caused the ventricular fibrillation. Prevention. If a physician determines that the ventricular fibrillation results from scar tissue due to a heart attack or some structural defect in the heart, medications and medical procedures may be recommended to minimize the risk of ventricular fibrillation happening again.